All right, so let me do my little blurb here. Welcome, everybody, to another episode of the Surdentity Podcast. I am your hostess, Elizabeth Dewar Anthony, and today I have with me the beautiful, vibrant Claudia Lovato. She is a dental consultant, she's a speaker, and she owns Morado Allied Speakers and Consultants, and she's based in Arizona, one of my very favorite places. And today we're just going to get to yakking about, the things that matter to us. And what matters to us is how we treat our patients, right? Tell me the story you just told me about when you were a dental and ortho assistant.
So I've spent some time working in the ortho practices, a few of them. And if you know ortho, you know that they're set up in an open bay style. And so you can hear everything. And I have a bit of a reputation for just speaking my mind and blurting things out. And I at one point I overheard an assistant berating and scolding an adolescent aged kid who was, not doing a good job with their oral hygiene and just really had fuzzy teeth. They were growing fur, as happens in orthodontics with ortho patients. But there was no hygiene instruction going on there. There was a lot of, you know, language that was not helping. It wasn't educating. It was just shaming. And I didn't like it. And without thinking, because I like to say I'm all gas, no brakes, and I just blurt things out. I don't have Tourette's, but sometimes I wonder. I wonder. And I sounded like Christopher Walken from that old show. I don't know which show Christopher Walken was in, but I was like, hey, you're talking to my guy all wrong over there. It's the wrong tone.
Wow.
And I mean, it just came out, it's the wrong tone. Knock it off. Like, hey, and I know that's not the best thing to do. We don't want to do that. But, it opened up a conversation. And the conversation later was, what were you thinking? If that language and that approach would do to promote and improve this child's oral health, their oral hygiene. How was that going to help? How was it helping? How was it inspiring this 14-year-old boy who was going through puberty and, all the things that happen to a kid's body when they go through puberty? Yeah. And how is the way you were talking to this person, this child, educating them and inspiring them to do better? And so that's that's the backstory of a little bit of my reputation. All gas, no brakes. I'm going to say it. I've gotten better at pausing and not saying what's on my mind immediately. I have good days and bad days and moments, but I'm known for that. I'm known for just saying what's on my mind. It's a little bit of a impulsive thing that I do, but it's usually, what's top of mind. Don't talk down to patients. So
Exactly.
it's a big time pet peeve I have, and it's not just from my experience in orthodontics, but in my years in general dentistry and being in the clinic, and there's just it makes me so sad when I have a full grown adult, sit in my chair, look me in the eye, and say, you're going to scold me.
Yep.
Or I know you're going to scold me, aren't you? I know. And I look at them and I go, who hurt you?
Yeah, exactly.
Right? Who hurts your feelings?
Yes.
Who did that to you? And I don't
Yes.
like that. I don't like that. And so yeah, don't even get me started.
So,
started
yeah,
because that's a thing.
I did nursing home dental hygiene for 13 years. And two things. First of all, I had patients that couldn't tell me what day it was, but they could tell me about their visit to the Eastman Dental Dispensary 70 years prior. And they were fully expecting to be shamed. Oh, I haven't had a chance to brush my teeth. Oh, you know, and they were expecting to be shamed and hard sold. I don't want any I don't want any crowns. I don't want any expensive treatment. I begin my talk by saying I am here to smash the legacy of pain and shame that dogs my profession. And why? It's not like there was a course on shame in dental hygiene school, but it was certainly modeled for me. Why do we treat these people like they have some sort of moral failing?
I don't get it. And I have to say, it's kind of like, have you ever had a bad experience at the DMV? The DMV,
They
they
don't
have
care,
a
man.
reputation. And I'm like, do they go to the same training in every state I've ever
Yeah.
lived in? I'm like, did they all go to the same training on how to interact? How does that happen? And then so sometimes when I interact with patients and they've had this experience with hygienists that schooled them or dental assistants or dentists
Hmm.
that scold them, I'm like, do you guys go to the same training as a DMV?
Hmm.
I think like, is that like are they multi-purposing that training program where we just train people or tell them it's okay to do this, to talk to people
Right, that
this
it's
way?
okay.
We
And
gotta we gotta get rid of that stigma. We gotta get rid of that
absolutely,
old uh, reputation. We've got to run that reputation into the ground and get rid of it,
I'm trying, and it
eliminate it.
is slow going, girl. Um, you
But
know,
it's a worthy cause.
I think
I
so
think
too.
it's
So
worth.
I'm gonna keep
Yes,
after
I agree.
it. um, so this patient, we have to step away from the dirty mouth. I don't even like to say, I don't even like this dirty versus clean, because it's not. It's you know, with all the technology that's available today, with saliva testing, with you know, digital scanning, all these things. What's the first thing a hygienist does? We stick a freaking metal probe in their gum line and take a measurement, and then and we torture these people. We probe their whole mouth for a bunch of numbers that are subjective at best and painful. And when we could just as easily test their saliva, look at their plaque under a microscope, and get better information. But yet, this is what we do, and and then it's like, well, you need to floss more. And people they don't, first of all, they don't floss. Okay, people don't floss. You know who flosses? Dental hygienists floss their teeth. And people who've had periodontal surgery, who are have spent thousands of dollars to keep their teeth. But so we can stop traumatizing people if we start to approach them with empathy, and stop just looking in their mouth and saying, your mouth, or implying that your mouth is dirty. So because your mouth is dirty, you're some sort of a bad person.
Hmm.
And look at the
Absolutely.
whole picture. You know, there's I've talked to a bunch of people on this podcast about um, you know, how much your mouth tells you about your whole body health, and how dentists 100 years ago, or freaking Hippocrates, had a much better idea of the mouth as part of the body.
I
And
agree. Yeah.
we've got to stop. We've got to stop with the pain and shame. So tell me about so you're going to launch a book. Do you want to talk about that?
Sure. When does this podcast go live? When do
Oh,
we share
this
this?
won't go live till weeks and weeks because I have a backlog of episodes. So
Oh, good. Oh, good. Okay. So I've been writing a book, and the book is called In Spite of Myself. And the subtitle is Confessions of a High Functioning Neurodivergent.
wow.
And it's really the first confession is the book itself, because
Mhm.
most people that I interact with don't know that I'm neurodivergent. They don't know. And I've become really good at masking. It's a term we use that I didn't realize I was doing all these years,
Yeah, yeah.
just to fit in and just to look and appear normal.
Right.
Uh, so, it's really been it's been an adventure writing a book, and a journey of self-discovery in writing it, because it's telling my story from early on childhood up through adulthood, because I wasn't diagnosed until I was an adult.
Well, when you were a kid, did they even have that sort of a sort of thing? I mean, my brother's neurodivergent, but back then they just said he was bad. He,
Well, yes.
yeah, the nuns just slapped him around with the ruler and said he was
Absolutely.
incorrigible.
Well, so that's the thing. I'm a 70s kid,
Yeah.
and we didn't,
No.
you'll hear a lot of our generation say, oh, we didn't have that back then, right?
Hmm.
Oh, we just had little Johnny back then that couldn't
Mm-hmm.
sit still. They got sat in the corner with a cone dunce hat
Yup.
on.
Yup.
We had little Claudia, which was me writing 100 times on the chalkboard. I will not talk during class.
Oh, yes. Oh
So
my
when
God.
people say we didn't have that back then, we absolutely had that back then.
Right.
We just didn't have a diagnosis, and we
Right.
didn't have pediatricians and doctors studying the behavioral, uh, what they call disorders for some things. I
Mm-hmm.
don't call it a disorder, but I don't like that word. But so yes, I grew up all my life as a child through childhood, adolescence, and then into young adulthood, not diagnosed, and just figuring out how to function in spite of the things that are challenges for most people. So neurodivergent, or I like to call it neurospicy. I'm neurospicy, but the neurodivergent brain, what that means, and if you've never heard that term before, it's basically there's neurotypical brain,
Mm-hmm.
which is where the brain receives information and processes it with ease in a normal way. And
Mm-hmm.
so a neurodivergent brain, um, unfortunately, doesn't process information the
Right.
same way. And so
Right.
there's little bumps and roadblocks and twists and turns when we receive that information. What do we do with it? How do we process it? And so it is different. And what we do with that after we process it, it can be different. Like I mentioned earlier, I will impulsively blurt out what I'm thinking,
Mm-hmm.
what's on my mind, especially if it invokes an emotion in me, like if you're shaming an adolescent kid about their oral
Mm-hmm.
hygiene, I'm instantly going to say, knock it off, cut that
Mm-hmm.
out. So don't hire me to be in your clinic. Luckily, I'm not a clinician anymore. So I was a great clinician, by the way,
I'm
um,
sure.
because I had the ability to empathize and connect with people. I
Yes.
can. So the thing about neurodivergent people is we seek each other out. We can see it in others, and there's so many people out there. So being neurodivergent, it could mean anything. It could be
Mm-hmm.
attention deficit disorder, it could be anxiety, it could be PTSD, it can be someone suffering from depression. There's so
Mm-hmm.
many. It's a spectrum.
Yeah.
And so, but we notice when someone's struggling. For instance, I went to a corporate event about a year ago. And, when you go to one of those and you don't know anybody, or you're not sure if anybody there you'll know, you walk into the room, and I can spot the neurodivergent people as soon as I get there, because they're uncomfortable. I
Mm-hmm.
can read their body language, and I'm like, oh, I'm uncomfortable. you're uncomfortable. I'm going to come and stand with you and I'm going to talk to you because I can tell you just want to crawl under a rock and die right now.
Mhm.
And I'm right there with you. So let's
Mhm.
stand in that together.
Yeah.
And so we seek each other out where we notice it in each other. So as a clinician, look at I'm going this way and that way, but as a clinician, that made me really good at understanding someone in the chair that's terrified,
Yes.
that's anxious, that's scared, claustrophobic. I'm claustrophobic. So I came at that from a place of I understand you. Your
Mhm.
fear is not irrational to me. Your fear is very real and I understand it. And you're going to be okay because I'm right here with you. And we're going to do this together.
Yes. What that, you know what? That is so, that's right there. Okay, you pretty much just summed up surgeonity. And you know, empathy, approaching a patient with empathy and non-judgment is is the key to a positive interaction. And so you look at these people, you look at a patient, these people, you look at a patient who and you can see, and you see fear and you see anxiety and you see, so another person will look at this patient and see this person is rude, they're controlling, oh my god, she's a batch. And so what's
A
your,
PETA, right? A
yeah,
PETA.
yeah. So what a PETA.
Yep.
So what Surdensity teaches is how to look at how to reframe what you're thinking. And I came up with patient presenting archetypes.
I
Fearful
like that.
presenting as, fearful presenting as hostile,
Ooh.
fearful presenting as hysterical,
Mm.
fearful, his fearful presenting as hysterical is the woman that comes in, she's late, she's on 20 different medications, she's taking care of everybody else, and she's got all this drama, and then and she doesn't want any treatment, and she's got a high gag reflex, and you know and this is, so instead of, so, oh my God, Mrs. Jones is such a batch. Let's take a look at Mrs. Jones. Okay. Mrs. Jones has, she has forward head posture. Okay. She has huge mandibular tori. She has a flat upper lip. So she's got a deficient maxilla. Mrs. Jones is a mouth breather. Okay. With a high gag reflex. So she's, when she steps into the dental office, you can relate to this. She's already, her sympathetic nervous system is engaged and she
Mhm.
is in fight or flight, and
Yep.
she's going to look for any excuse to get the hell out of there. And anything that I say to her, if I'm saying it in the tone that you're talking about, she's going to become defensive,
Yep.
right? It's
Yep.
going nowhere. And then she's going to get all bent out of shape and jump up and walk out, and then the hygienist is going to complain about her in the Facebook group. Oh my god, I had this rude woman today, blah blah blah. And I'm like, oh my god, can we please, there is a way to not have that happen. Am I making sense to you?
Totally. I mean, I can, so when we're talking about this, because you said, well, you said, what do you see when that person's in the chair, right? And
Mm-hmm.
so for me, I see me.
Yeah.
Okay. So I am very claustrophobic. I am a nose breather. I'm not a mouth breather, but this part of my face is life for me.
Yeah.
This is life's breath. So you get a mouth breather and then you want to plug the hole. You want to
Right.
stick your hand in someone's mouth.
Right.
Hey, let me just plug the hole so you die. I mean, because to me, I know for a fact that that's a feeling of, am I going to die? Like, are
Yes.
you,
Am I going to die? I'm going to die.
so it seems that's not irrational. It's only irrational to you, the hygienist, if you don't understand how it feels to suffocate.
Right.
I'm a nose breather. Okay. Uh, when I get a cold and my nose is stuffed and I can't breathe,
Mm-hmm.
you might you I've almost asked the doctor to sedate me, just knock me out, wake me up when my nasal passages open up,
Mm-hmm.
because
Mm-hmm.
I'm pretty sure this is how it all ends for me. That
Mm-hmm.
seems irrational, right? But
Right?
when I can't breathe through my nose, I'm like, this is it. This is how it all ends. I'm gonna die. And my husband's like, just open your mouth.
Right?
Oh yeah, it sounds real simple. Just open your mouth. I'm like, I'm a nose breather. I get it. And so I am obviously alive, so I'm breathing
Right. So
through
here
my
we are.
mouth.
So we're, obviously we're breathing, but you are rare. True nasal breathers are extremely rare in Western culture, especially in American culture,
Hmm.
because we don't have to, because the nasal passages, most people have, some sort of rhinitis all the time, and their sinuses, their tongue blocks the nasal passages in the back of the throat. So they are primarily 90% mouth breathers. So yeah, and I'm going to put something in your mouth and your brain's like, "Oh hell no."
Nope.
And then I'm like, "Well, I need to do this because,
Yeah.
blah 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 blah." And the brain's like, "No. No."
Well, and for me, it's even the feeling of vulnerability. So
Yeah.
I see me when I see a patient that's afraid. So for me, the most vulnerable thing you can do to me is take me in a room and lay me on my back.
Mhm.
Just laying me on my back. I can't. If we go back like to our primal instincts are
Exactly.
to survive. If I'm an animal, and if you look at me at an animal that needs to survive, and you lay me on my
Right.
back,
Right.
I
Animals
am
don't
now
do
my
this.
belly up like a dog.
Right.
Dogs
Like,
trust you. You know a dog trusts you when they show you their belly. Oh,
right.
rub my belly, right? I don't know you. You want me to be belly up in your chair, laid
Oh,
all the
that's
way back?
amazing. Yes. Right. That's like
I don't trust
total
you yet.
submission. Just go ahead.
Just do your will, do what have your way, do whatever you're going to do to me.
And then
And that's insane to me.
right.
That's
And then we wonder,
insane.
but so why are dental people like confused about this, or like, I don't understand. And
Well, I have something new that's just happened to me recently. My mother-in-law, who was in her 80s, she went to a dental practice that I referred her to, and she saw I don't know if they had an associate come in. I had never met him before. Um, but my mother-in-law is 85, and she has the gold standard, literally, of um, dental work that was
mhm,
done in Italy
mhm,
in probably the 60s, and it's still there. And she takes extreme good care of her teeth, and they're not going anywhere. She doesn't have periodontal disease. She does, so she's just going in, and you send her somewhere new, and oh, you need all of this replaced. And so that's all good and fine. I expect that, whatever. But she's British. She's from England, and she's laying back in the chair with a hygienist when the associate comes in the room, doesn't sit her up, stands behind the chair, talks to her, and tells her she needs all this dental work. Doesn't introduce himself, and then leaves, and she's on her back. And she was disappointed. She came home, and she was upset. And I said, I'm going to go there with you next time. And I said, I said, but when you talk to them, I want you to talk to the hygienist. I said, if you've got some little spots here and there, and I looked at her x-rays and I looked at everything. And I said, ask them if they do SDF, right?
yeah,
Silver dibiphylite. I said,
yes,
see if they do that. I think that's all you need. Let's just get the margins, whatever. Like I said, it's been ages since I've been a clinician, but I, live in that world. And so I said, just ask for some SDF. So that was all good and fine. But I went with her to that next appointment, and she went back, and I had a conversation with the practice owner slash office manager. It's a spouse of the
mhm,
practice owner. And I just said, this is the experience my mother-in-law had with your associate. He came in the room while she was on her back. He didn't face her and make eye contact with her. He didn't introduce himself. He spoke behind her on the side so she
Mm-hmm.
couldn't see him in the face, and then pitched a treatment plan to her for what, and then was irritated that she wasn't responsive and not really interested, And I said, do we need to talk about everything that went wrong here? Or do
Mm-hmm.
you understand what went wrong?
Mm-hmm.
Just based on what I just said, do you understand what just went wrong? I said, because it's unacceptable to present a case, a treatment plan to a patient when they're on their back.
Mm-hmm.
It's unacceptable to talk to a patient without making eye contact with them. And it's
Mm-hmm.
unacceptable to talk to a patient without formally introducing yourself. Take your glove off and shake their hand. I said, this is an 85-year-old woman who's
Mm-hmm.
lived through war times for most of her childhood. So if we want to talk about anxiety, PTSD,
Mm-hmm.
she was born into living in England when
Right.
the Germans were bombing the city.
Right. Right.
Bomb shelters, gas masks, didn't go to school until she was 6 years old when the
Mm-hmm.
war was finally over. Remembers the celebration in the streets when the war was over.
Mm-hmm.
Remembers meeting American soldiers, giving out candy bars. That was her first candy bar. And
Mm-hmm.
so you don't have the decency to look her in the eye, shake her hand, introduce yourself to her. I don't think so. Don't ever do
Mm-hmm.
that again. And that's me. Not all gas, no brakes. I'm just going to say that. And I will say, don't ever do that again.
Mm-hmm.
That's unacceptable.
How'd that
And
go over?
so, I I guess I get shocked. You would think I wouldn't be shocked anymore with the fact that people are still doing that they're still approaching patients in that manner, that they're
Mm-hmm.
still doing that. Um, but it's still going on, and I just think there's work to be done. And like we started this conversation with, can we just bury that old reputation that we're going to scold our
Yes.
patients, we're going to
Yes.
blame and shame our patients, that we all got our training at the DMV with the
Right.
DMV?
Right.
Can we just end that? Can we work towards getting rid of
Right.
that
Can we just, yes, I
reputation?
want to, I
The
want
only way
to
to
just,
get rid of it is to stop
yeah, it's just to stop.
acting like that. Stop talking down to people.
Yes.
Be
And
respectful.
yeah. And it's really important for people like you and me to speak about these things and to get this message out there. And it's not a popular message, because it's not about, oh, how do I make more money? Well, newsflash, when you treat people well, they want to come back and they refer their friends, and that may just help you make a little bit more money.
They
But
tell their friends and neighbors and family.
yeah,
They'll refer you till the cows come home. You won't
right.
be able to keep up with it if you
Yes.
transform your dental practice
Um,
to a practice that practices empathy and treats their patients with respect and dignity, that
yes.
understands and has empathy. You
Yes.
will not be able to keep up. You'll have to hire an associate. You'll have to expand your practice. You
Yes.
have to build bigger.
And these patients that have walked into other offices and been dismissed can come to you, and because we treat them differently and well, they become a friend. They come in as a foe and they become a friend. And it is possible. It's my lived experience for 20 years that how I approach somebody makes a difference. And
Absolutely. Absolutely.
wow, this has been an amazing conversation. I'm so glad that you got in touch with me. Oh my gosh.
Yeah.
You know, I love I love talking about this. I could obviously talk about it all day because it's important. And it to me it's the bottom of the pyramid, right? And treatment planning and technology, blah blah blah. That's all once you get this.
Mhm. This is first remembering and acknowledging that we're treating people, not teeth.
Yes.
These are
What?
human beings with feelings, and what may seem irrational to you is, whether you think it's rational or irrational, it doesn't matter. It's a real feeling that
Yes.
comes from something. Something caused that. Sometimes it's trauma. Sometimes it's dental trauma. I've had dental trauma. My jaw locks open. And so every time I've had any procedure that requires me to open, I know where how far to open up. But
Mm-hmm.
if I'm numb, I can't control that. Or I will hold it, my jaw will start to shake. And
Mm-hmm.
after a period of time, boom, it's out. And now my jaw is open. And now, and so you're an airway person. When the jaw does that,
Mm-hmm.
everything starts to close up.
Yep.
And
Yep.
I'm a nose breather. Even
Yeah.
the air
Yeah.
coming in through my nose, it's like breathing through a straw.
Through a straw.
So
Yes.
that's real trauma. So I've gone to a dental practice. I've warned them I have TMJ issues. They've heard it.
Mm-hmm.
Everybody, oh, doesn't everybody, right?
Right.
That's what
Right.
we say.
Right.
No, I don't, okay, so I get dismissed. Okay, here we go. Are you ready? And then I sound like a crazy person saying, well, it's real. And if my jaw locks open, there's potential you may have to break my jaw to close it.
Mm-hmm.
And then they look at me like, well, now you're crazy.
Right.
I don't want you in my chair.
Yes. I don't
Go
want you in
somewhere
my
else.
practice. You have to go.
And but at this point, they know I'm a dental person. So they don't want to do that because I might talk about it to somebody,
Right.
right? I might be on a show and
I
we're gonna have this talk,
might be on a
right?
podcast talking about it.
Yeah, we're gonna talk about you. So then it's like, okay, so they're like, you'll be fine, Claudia. You'll be fine. And then 30, 40 minutes later, after my hygiene is finished, okay, you can close now.
No, I can't.
No, I can't. Now, when I do that, you can see it in my face that it's happened because the structure of my face changes in the bone. You can see it, and you go, "That just happened." You weren't exaggerating. You weren't
Right.
being irrational. And
Mm-hmm.
oh, snap! How am I going to shut your jaw? And
Mm-hmm.
so this doctor had literally cover his thumbs with towels,
Mm-hmm.
get the thumbs into my jaw, manhandle my jaw, and manipulate it to get it back.
Oh.
But see, if I go to a new practice, they don't know me. I'm going to sit in that chair. I'm going to tell the same story that, oh, I
Mm-hmm.
have a problem, and they're going to dismiss me. And they're going to go, yeah, you and everybody else's sister has TMJ. Okay. So let's stop treating patients like that.
Right. Let's
Don't be
start.
different with
Yeah.
me because you don't have a dental background.
Right. Let's start giving people some credit for knowing a thing or two about their own experience.
Yeah.
You know, when you were also when you were talking about your neurodivergence, I saw a lot of the same things that we see. You were made to feel like it was some sort of a moral failing, like this brain chemistry that you have that creates these perceptions that drive your behavior was made you were made to feel like it was something wrong, something bad.
Well, it's really interesting. My story's a little bit different. So I was really invested as a child. I won't tell the whole story because it's in the book.
Sure, sure.
But I was very lucky that my parents, because I was early reader, I read before kindergarten. I couldn't get enough information. So I do not have a deficit of attention, even though
Right.
I'm diagnosed with attention deficit disorder.
Hmm.
uh, I have a lot of attention and I will
Right.
hyper focus. And so when I'm excited about something and very interested in it, I'm obsessed with it. So I became
Yeah.
obsessed with learning how to read before kindergarten.
Yes.
So my early educational experience was exciting, and I was a straight A plus student. Okay. And
Mhm.
everything made sense, and it was all new information, and my brain couldn't get enough of it. And my parents were just so proud. Then school got boring. When you learn, when you master something, now what?
Mhm.
Well, I always kept reading because I can, there's always going to be
Mhm.
more books. But if it doesn't make sense and have a real purpose for me, like algebra and calculus, I'm
Right.
not going to do that. And so my grades started going down, and but I had parents that knew and reminded me when they'd see a bad report card, you're smart, we know you're
Mhm.
smart, we're not sure what's going on here, we don't know what you need to do, because I had older parents
Mhm.
also. They had me old and age, so they were dumbfounded. What do we do with this? But they said, but you're smart and we know it. So you got to figure life out. We can't do it for you. And
Mhm.
so I never felt bad about myself.
Mhm.
That's what makes me weird and wild and crazy and successful. And so the story, the book came about because people would go, I had no idea. That doesn't sound believable, because we see you out here just doing great things, big things. You've been very successful. You have a successful career. And so it's not really believable that I have all these diagnoses. I'm on the autism spectrum. I'm attention deficit disorder.
Mhm.
I have impulsivity behavioral disorder. That's where I'm like, shout what's on my mind. But those are the very things that they call disorders are the very things that make me creative.
Mhm.
They make me take risks where someone else will. I'm not going to overthink anything. I'm going to figure it out. And I'm not afraid to fail. I fail all the time. I've mastered failing. I create my own chaos, and so I'm a professional problem solver, because my life has been full of problems to solve, self-inflicted sometimes, most times. And so that's the story, really. And it's to help parents
Mhm.
who have kid children and they don't know what to do. Like, my story is mine. It's not everybody's story, but it's a perspective to talk about how my parents responded, because how
Mhm.
they responded to my behavior shaped my ability to function
Mhm.
and not feel like something was wrong with me.
Awesome.
Yeah. And the educators, the teachers, that wasn't a thing in school, but how some of those teachers responded to me
Mhm.
made a difference. They showed me I could learn. I just
Yeah.
learned
Yeah.
differently. I learned differently.
Yes.
And from an employer standpoint, when you have, I guarantee you, if you've got more than 3 employees, you've got someone that's neurodivergent on your team. And, the levels of it it's a spectrum. And so, someone, I remember postpartum depression.
Mhm.
I not dealt with depression, but I dealt with postpartum depression. That I went into the break room, sterilization room, after I went back to work after maternity leave, and had a meltdown. That's irrational, right? What are you crying about? Nothing happened. What are you crying about? And so it takes another coworker to recognize that, have empathy, and said,
Mhm.
it's going to be okay. I know what this is. Let's get you some help. I've got some resources,
Mhm.
And so that part of the story, so the story goes from childhood all the way to dentistry, to my career, and beyond, and to
Mhm.
entrepreneurship. And so how does a person that's masked their entire life and hid this thing that gets in the way every day, moment to moment, how did I do that? And how did I achieve success? And so I hope it brings hope to some people, like parents. It gives them hope
Yeah.
when they're in the struggle, because it is hard. I hope it minimizes the stigma that comes with a diagnosis, because there
Mhm.
is a stigma. Like, people there's a lot of OCD people in dentistry, and we go, oh yeah, I'm OCD, and everybody's okay with that. That's not the big ugly word, right? Because
Mhm.
people with OCD in dentistry, they're high functioning, high performing,
Mhm.
meticulous, detail oriented. We love all those things that come with
Mhm.
that disorder, the D in OCD.
Mhm.
But nobody's going, oh yeah, raise your hand if you have attention deficit disorder. Nobody wants
Right.
to raise your hand and admit that, but you don't. Guess what? I've got a little secret.
Right.
Everybody knows you have it. So, but there's a stigma that goes with that because if you don't have it, you think people that have it can't focus, can't pay attention, aren't
Mm-hmm.
very smart, never finish what they start. There's so many things that go along with that
Mm-hmm.
diagnosis that people don't understand. So I hope that it's going to pull back the curtain, as you will, and shine let you see it from a different perspective, what the neurodivergent brain is like, and shine a light on that. And then for employers, there's a lot of talk about diversity in the workforce, right?
Mm-hmm.
And we want to be inclusive. No one is talking about the neurodiverse workforce.
Mm-hmm.
We don't talk about that. It's kind of like that Encanto, a Disney Pixar show, Encanto, where
Oh, right, right.
we don't talk about Bruno. We don't
Yeah,
talk about Bruno,
right,
because Bruno was like appeared mentally ill,
right.
we don't talk about Bruno. So we don't talk about the neurodivergent people on the team. We're not going to address the depressed coworker or the
Mm-hmm.
manic or the OCD or, all these things. And so from an employer's perspective or a leader or a manager, I hope it pulls back the curtain for them to see some little nuances and behaviors from the team that you go, okay, I get you now. I get why you
Mm-hmm.
do that. And so at the end of the day, we just don't fit in this perfect little box, but we can still get the job done.
Mm-hmm.
We find a way. And as long as we're getting the job done and we measure up and we do a great job, then be okay with the approach, because the
Mm-hmm.
way I approach things is so different than probably you do. And
Mm-hmm.
and so it's just understanding people and our differences and our brains, how amazing they are. They all work different and process things differently.
Mm-hmm.
And then we're back to the patients,
Yeah.
understanding the patient that you think is irrational, uh,
Mm-hmm.
dental phobe, anxious, uh, hysterical, like you said. I hate
Mm-hmm.
that word hysterical. They used to call women hysterical when we
Mm-hmm.
have go through menopause or whatever.
Mm-hmm.
They didn't know what to do with us because we were hysterical. Our
Right,
brains,
right,
our bodies weren't creating the hormones in a normal way. And
right,
oh, we are hysterical as a
right.
diagnosis.
Let's give her a lobotomy.
Exactly. So thank goodness we've come a long way with those
Yes,
days, but there's work to be done. And so
there is.
I'm excited to share. Again, this is very vulnerable for me to share my story.
I
Uh,
am honored.
and thank you. Thanks for this conversation. I love talking about this stuff. I love people. I am obsessed with the human condition and human behavior.
Me too.
And I think as providers, if you're not obsessed with human behavior and the human condition, you should be,
Mm-hmm.
because we have to understand that first before we understand
Yeah,
who
I
and how to
completely
fix
agree.
them.
So we've been on here for almost an hour, and
Oh
it just
my.
flew by. And
Yes.
and you know what? I kind of figured it would. So you are awesome. Thank you so much
Thank
for opening up to
you.
me and your vulnerability and your honesty and agreeing with everything I say.
That always helps, right? That's
That
some
always
good guests. I've been on a podcast before. Agree with the host, agree with the host.
So God bless you, and I will look forward to running into you sometime in person.
Absolutely. Thanks for having me. Have a fantastic day.
You too.
Bye-bye.
Bye.